According to the United Nations Children Fund, Nigeria lost 162,000 children to pneumonia in 2018. Though preventable, pneumonia has become one of the major causes of infant mortality in Nigeria. In order to reverse this negative trend, the federal government says there are plans to ensure that primary health care centers are available throughout the country and functional too.
If current childhood-related pneumonia mortality trend continues, especially with the advent of the Delta variant of the coronavirus, the SDG under 5 mortality reduction target of less than 25 deaths per 100 per 1,000 live deaths will not be achieved by 2030. Therefore, Nigeria needs to accelerate efforts towards reducing the burden of pneumonia and other childhood killer diseases. And our target is 1 primary healthcare center per political ward, gives us about 9,400. At present, we have barely 6,000, and of those 6,000, majority are not yet with the complement that we want, because we are looking for a primary healthcare center that can function 24 hours a day. And for that, it has to have staff quarters where staff can stay overnight. It has to have electricity.
Development partners promised to do more to help Nigeria to fight pneumonia and other diseases.
90% of under 5 mortalities as a result of pneumonia in Nigeria. So for us as WHO, what are we looking at? We want to ensure that there is need to clean air pollution. Reducing air pollution will deliver significant benefit to health and environment. But however, we also know that there's a coalition called the Every Breath Count, and WHO is one of these coalitions. And within this time we are celebrating or commemorating the World Pneumonia Day, we want government to look at the issues around air pollution relating to pneumonia, and mostly around under 5 mortality. And by doing this, we also want to ensure that there's a huge commitment in reducing the air pollution-related pneumonia up to 50% by 2030, and they're looking at the SDG.
From a recent release by UNICEF and Save Children, that close to 30% of all deaths attributed to pneumonia are somehow connected to air pollution. And I think with this type of risk factor, we probably would need to look at that strategy, take a second look at it, and see if there is something we can do to pay more attention to this particular problem.
The global theme for the 2021 event is pneumonia and environmental pollution. Thuraya Faruq, Arise News.